Hello everyone, this is Mohamed Baklola, recent graduate from Mansoura University, Faculty of Medicine in Egypt. I came here to present the results of our latest two studies. The first one is about mental health literacy and help-seeking behavior among Egyptian undergraduates. It was a national cross-sectional study. I will present the findings of this study. Regarding the table of content, we will talk about all parts of the study from the background to the conclusion and recommendation. First of all, the background. What is the meaning of mental health literacy? I think that's an important question that we should ask ourselves before talking about our study results and the methodology. Mental health literacy is the mental health knowledge and perception toward mental health disorders. Plus that, we add the perception toward the stigma about mental health disorders to the mental health literacy concept. Mental health literacy also entails three things. First, identify the mental disorders, to manage the symptoms and to make preventive strategies to prevent the mental disorders. So, by studying the mental health literacy, we could make a knowledge map about the population we study mental health literacy on. This made us hopeful to make knowledge map about the present status of mental health awareness, knowledge, and perception in Egypt to be the basis of comparison for the future studies in Egypt. And to do that, we should first specify a population to study mental health literacy on, as we couldn't cover all the population. And that lead us to our objectives, which is first one, to study the levels of mental health literacy, and second one is to study the help-seeking behavior among Egyptian undergraduates as our population, our target population. We chose that specific population due to various reasons. First of all, it's easy to reach. We could collect data on from this population easily. And the second thing, that phase of human life is full of stressors, and I think it's one of the most important phases of human life that you should study mental health literacy and mental health disorders on, as this is a critical stage. So, what is the benefits? What are the benefits of our study? We all should ask ourselves, what are the benefits that we gain from conducting that study? There are a lot of benefits, but I briefly mention them in four main benefits. First of all, it will provide proper guidance for professionals and psychiatrists to use in their intervention. Second thing, by identifying the mental health awareness gaps and make the knowledge map we talked about it, we could find the gaps that we should focus on and on further and future research. The third thing is for training and making personalized interventions. The fourth thing is that will help us in continuous improvement, as if we know the map, we could make it as a basis for future studies. So the second thing, what about the methodology of our study? Our study design is a cross-sectional study with an analytical component. We conducted it in the duration of the academic year 2023-2024, and we used the convenience sampling method and data collection. And our target population, as I mentioned earlier, is the Egyptian university students, undergraduates, from all faculties, medicine and the non-medical faculties. So our study is comprehensive. We include more than 10 Egyptian universities from various locations in Egypt. So now, regarding the tools we used in our study. We used a survey consists of 3 sections. The first section is about demographic data. And these are common questions like age, sex, family history of mental illness, father and mother education, and if the participant had ever sought mental health care utilization. The second section is about the mental health literacy scale, and third section is about help-seeking behavior. Regarding the mental health literacy scale, we used a scale that has 28 items that assess the mental health literacy in 4 factors. Factor 1, measure the attitude toward mental illness. Factor 2, measure attitude toward people who have mental illness. The third one is about recognition of disorders, and the fourth factor is about the help seeking. So the 4 factors assess the mental health literacy comprehensively in the all items. Plus that, we used a tool called help-seeking behavior tool. These are some samples of the questions we used in English and translated in Arabic. Regarding the results. Regarding the results, first of all, we have in our study 1,740 participants, and that's a large sample. Most of them were female, exceeding 60% female, and also most of them were medical students, about 55% or 54%, and the mother and father education, most of them had university and or high school degree. The main regarding the question about pattern and history of utilization of mental health services, we have 11% of our participants who used mental health services before, and that's an amazing statistic that we should focus on. Regarding the questions related to mental health literacy, the main topic that we come here to talk about is I divided it according to the factors of the scale. So you will see results related to factor 1, results related to factor 2, results related to factor 3, and results related to factor 4. And I choose some results to focus on and to show you today. I'm not here to present all the results. You could refer to the published paper to see all the results and to get benefits a lot from our study. Regarding factor 1, which is about attitude toward the mental illness, we found that medical students show better in a question like to see the mental illness as a sign of personal weakness. We found that medical students recorded that question better than non-medical students. But regarding factor 2, which is about the attitude toward someone with mental illness, we found that non-medical students are more open to make friends, to deal, to marry people who have mental illness than medical students. And that was an odd result for us to see that medical students, despite being more knowledgeable about mental illnesses, there is still some stigma in their mind about the people who have mental illnesses. Regarding factor 3, which is about identifying mental disorders and knowing the proper definition of some of the most popular mental diseases, like generalized anxiety disorder, depression, schizophrenia, bipolar disorder, personality disorders. It's predictable that medical students scored higher than non-medical students. Regarding factor 4, which is about help seeking, we found that non-medical students are more open for face-to-face appointments and interviews than non-medical students. Overall, mental health literacy score show no significant difference between medical and non-medical students. Regarding the association between mental health literacy and help seeking, we found that there's a positive association between mental health literacy and help seeking. And we conducted logistic regression to assess the predictors of help seeking, and we found that being female and age 21 or older and has family history and being from urban residents, all these are predictors for help seeking toward mental health services if they have mental health problem. This is a summary of all the results. I talked about it, and as I said, we have more than these results. You could refer to the published paper. Regarding our conclusion is that mental health literacy in Egypt is not the same for different subpopulations or subgroups. Every subgroup of population has its own knowledge map and should receive targeted or personalized interventions to improve their mental health. And all policymakers and professionals should know that well. Regarding the limitations of our study, we have some limitations as any research study has. First of all, the study design is cross-sectional and that don't take the causal relationship. And the second thing is the online distribution and collection of data. Third thing is self-selection bias. We have that limitation also in our study and the methodology. And the last thing is depending on tools. Our recommendation is to take our results into considerations by the policymakers and psychiatrists and professionals in making personalized interventions and making targeted awareness campaigns that take into consideration the difference in knowledge maps between different populations. And that's all I want to deliver today and talk about our study. I made a brief presentation about the study and we have a lot of stuff. Thank you for listening.